I would like to introduce you to your pregnant pelvis. Okay, so in the third trimester, more relaxing goes to all these joints, so your hip joints, your pubic bone, and that's so that your pelvis can move when you're in labour, gives your baby all the room he or she needs to make their way down through the birth canal. But what that does mean at the end of pregnancy is that that's where you can get some aches and pains from, because the relaxin hitting these joints might not be even, so there's more pressure on joints. That's why sitting evenly, not sitting for too long, using a birth ball to sit on can make a difference, because it can allow these joints to kind of have even pressure on them and to move. Whereas if you're sitting for too long, there might be too much pressure on your sacrum and your coccyx. And if you're sitting on the sofa and leaning on one side, there might be too much pressure on one hip, which can make it sore. So even pressure, and even getting off your bottom and sitting, so kind of kneeling and leaning over a bit more, kind of especially in the evening, maybe it's when you're relaxing a bit and you might be feeling the strain kind of in your back. Look at, that's the space for baby. Okay, so this is why babies ideally need to be on their left side, because they need to be on their side to slot into the pelvis there. If they're back to back, they can't get into this space properly. And then what happens is, so in entering the cervix, side to side is wider. On entering the pelvis rather, on leaving, it's wider this way. So that's why babies have to do some turning, and that's why gravity is really important in labour, and being upright as much as you possibly can be. So try and bring some positions into the end of your pregnancy, because it will allow you to get used to using positions to be more comfortable. That in turn can help your baby to be in a better position to slot into the pelvis. And then you can use positions to allow your baby to make their way down through the birth canal as well. So they need to do a little bit of a dance, do some turning to fit through the pelvis. And that's harder if you're lying down, because if you're lying down, you can see the coccyx is sticking up there and it kind of closes down this space. Whereas if you're upright, your sacrum can move and it can lift the coccyx out of the way, which just opens up the space there for your baby. So gravity and movement is key. Listen to your body. It will try and guide you as much as possible into positions that are optimal for your labour and for your baby. So don't second guess yourself, kind of, and maybe don't overthink it. Go with what feels right for you when it comes to movement and positions in labour. If you're on a bed because you want to be, or because you've had an epidural and you need to be, it is still possible to have some gravity. So you may need some help and support to get round onto all fours, but it can make a huge difference. So having that as part of your plan for managing labour and helping your contractions to do their job is a good part of your preparation. You can pop me some questions in the comments, and I'll just keep talking more about how labour and birth works, so you can think about what strategies you might need to help labour flow, so that you can find what works for you and so that you can manage any challenges. Talk again soon.